heart disease, diabetes, tobacco use. Those are just a few examples of health inequities within the African American community. So, what does UC Davis School of Medicine, SAC Cultural Hub Media Company, and Sierra Health Foundation all have in common? The common goal of connecting physicians who are reducing those disparities within the urban community. Welcome to the second annual Black Physicians Forum 2012.
Gathering of over 200 people have committed to coming out tonight to talk about, think about, and come up with solutions to healthcare issues in the African American community.
I have the pleasure of speaking with the CEO and founder of SAC Cultural Hub Media Company, Ms. Plachette Robertson. Now, this is the second year for the Black Physicians Forum. What is the main goal that you would like to see? What is tonight all about? Tell us a little more about it.
Well, tonight is all about bringing doctors, physicians, clinicians, nurses, medical students, and healthcare professionals all to one platform where we can discuss how we can end healthcare disparities in the urban community.
I have the pleasure of speaking with Dr. Tom Hopkins, who is the Chief Medical Correspondent for KCRA3. Now, you are also the MC tonight. How are you feeling about that?
Great. It's great to be here. Pleasure to be able to participate in an event like this.
Where do you see yourself actually fitting into the address as far as offering solutions on taking preventative measures within the African American community as far as moderating high blood pressure, tobacco use, and just improving our overall health inequities? Where do you see yourself fitting into that?
Well, as a primary care physician and a specialist in internal medicine, you know, it's a role that I play every single day, not only as a physician but as a health educator, being a role model in the community, and participating in a variety of health initiatives and promoting awareness. So my role is to continue to do this. This is another platform to also to interact with my colleagues, interact with other people around the community, and hear their discussion about the issues and how to end disparities. That's a powerful moment for me to be able to be here and pass that on, because I think it's something that really has been lacking, and we need to continue to do this because there's great opportunities out there for us to improve the health of our community, and especially those people that are at risk.
Good evening, everyone. My name is Darren Lattimore, the Assistant Dean for Student and Resident Diversity at UC Davis School of Medicine. I think main message that I want to get out there is how proud I am to be a part of the third annual Black Physicians Forum. A gathering of over 200 people have committed to coming out tonight to talk about, think about, and come up with solutions to healthcare issues in the African American community. This is something that I think the Sacramento community truly, truly deserves.
Okay, I have the pleasure of speaking with Dr. Harris this evening. Thank you so much for joining us.
It's been a pleasure.
Now, is this your first time attending the Black Physicians Forum?
Yes, it is. It's my first. Apparently, I'm not too late to the game since this is only the second one being held, so I'm in pretty early. But yes, it's my first one. It's been quite impressive.
Great. So what do you find most impressive about tonight's event?
Well, the passion in the voices of the people who really recognize that there's a problem, a huge problem that is affecting African Americans, underrepresented minorities of a wide, diverse range, not just African Americans. And the impact that disparity is having on just so many aspects of our home life, of our development as individuals, and then that directly impacts our communities and how they're shaped and what's going on there. So it's quite a interconnected problem. And starting with the healthcare piece of it, because that's the piece at least that we might influence, is the place that we ought to, the avenue through which we ought to use our influence.
Right. And speaking of influence, a lot of times patients may be a little intimidated based on the appearance of a doctor or vice versa. And I must say you look great in your uniform tonight.
Thank you so much.
Now, how do we bridge that gap as far as getting the patients maybe to feel a little more comfortable and not be so caught up on appearance, or maybe the doctor is not the same nationality so they won't understand what, health ailments I may be going through? How do we bridge that gap?
Yes, there are many barriers that take place in the exam room. You go in, you see a patient, you look a certain way, they look a certain way. Maybe it's what you're wearing, maybe it's this uniform, maybe it's whatever differences they might perceive factor into how comfortable they might be relating to you initially. But my observation, after having cared for many patients over many years, is that universally people respond to a sense of you communicating to them that you care, that you care about what's going on with them, that you're not there to preach to them, you're there to understand what is ailing them. They have come to you as a physician for healing. And there are many levels of healing that you can offer a patient. And if you engage them, not only perhaps for the malady that brought them to you, you may have a very, very narrow specialty. They may be there to see you for a very specific reason. But if you engage them as a person, if you validate their worth as a person, if you try to empathize with the situation in which they find themselves, and use that as a guide and factor that in when you're suggesting what they might do to help themselves, because you're not going home with them.
Right.
You can't make them take the pill, you can't make them use the eye drop, you're not there to do that. But you've got to engage that patient so that they want to help themselves, and that they recognize you as an ally in trying to help them reach a better health state. So those other differences start to melt away very quickly once the patient perceives that you truly care about their welfare.
Right.
As a person.
Right. So human compassion is definitely key. Well, thank you so much, Dr. Harris. That's excellent advice, and we appreciate you joining us tonight. Thank you. I have the pleasure of speaking with Dr. Relaford, all the way from Los Angeles, California, who is joining us for the second annual Black Physicians Forum. Now, Dr. Relaford, you are the keynote speaker tonight. You were asked to come here and actually speak on physicians leading the way to reduce healthcare disparities within the urban community. Can you tell us a little more about that, and how important is that to actually get African American representation?
As you know, African Americans experience healthcare disparities disproportionately more than any other ethnic group. With that being said, we basically say all hands on deck. Which means that everybody who has a leadership role in our community has a responsibility to actually walk in the walk, to actually look like they represent a healthy lifestyle. So we're going to actually kind of call physicians on the carpet and make sure that they are eating fresh fruits and vegetables, that they are exercising, that when people see them in the community, that maybe they're on a track, or that they're walking, or if people run into me in the restaurant all the time, so they want to see what's on my plate.
They're checking what's on your plate.
What's on my plate, since I talk so much about being healthy. So I think it's important for physicians, since that they are in this leadership capacity, that they use that leverage as an opportunity to educate people along the way by what they do, not by what they say.
Absolutely. And within today's forum, what exactly are you hoping to accomplish by doing this?
I'm hoping to inspire and to ignite that something in everybody to make them more responsible and accountable to the people that they represent. If there's no accountability, there'll never be any responsibility.
Did you hear that? Inspire and ignite. Two of my favorite I words. Well, thank you so much. It is a pleasure having you here, and I can't wait to hear what you have to say inside.
Glad to be here.
Thanks, Dr. Relaford.
Thank you.
Good evening. We're at the Northern California Black Physicians Forum 2012, hosted by SAC Cultural Hub Media Company, as well as Sierra Health Foundation, and our primary host and title sponsor is UC Davis School of Medicine. We're here this evening because we are interested in eventually eliminating health disparities, and we're talking with Black physicians this evening in order to get collaborative efforts going in the community to educate them on different ways for behavior change and how it is that we can implement activities that would actually move forward this agenda.
Okay, I'm standing here with Dr. Yinka Davis. Thank you so much for joining us this evening. Now, is this your first year attending the Black Physicians Forum?
This is my second year. First year presenting.
Okay, first year presenting. Now, what do you feel is the key role of African American physicians today when seeing and treating African American patients?
You know, I think as physicians, we need to recognize the disparities that we see amongst African American patients, and particularly for me, it's obesity. So as a pediatric gastroenterologist, I deal with this on a daily basis. And seeing the kids coming in and seeing our children that are actually now 40% prevalence of obesity amongst African American children is a place where I think I can actually do some prevention and some education towards our kids.
So really but the main important factor is preventive care. Now, in today's society, it's unfortunate that a lot of people don't even have the health care insurance to even seek the preventative or, to get the preventative measures taken. So what advice would you give to those who may not have the ability to get in to see a doctor to prevent that?
You know, I think it's multifold. I think it's learning how to eat properly. I think it's getting away from a sedentary lifestyle. It's really educating our families on how to eat, because I think we've lost perspective of what food is. And I think so many of our kids, are targeted by these beverage and food industries on foods that are actually quite fat-laden and carbohydrate-driven, which leads to our obesity and our diabetes that we're now seeing in our young population.
My name is Michelle Villegas-Frazier, and I am the manager for the Office of Student Resident Diversity here at UC Davis School of Medicine.
Hi, I'm Dr. Valerie Yerger. I'm a naturopathic doctor and a assistant professor in health policy at the University of California at San Francisco. I've been at UC San Francisco for a little over 10 years, and I've been focusing on researching tobacco industry documents. So during the last several years, I've gathered quite a bit of expertise observing how it is that the tobacco industry systematically targets African American communities. I've taken the information that I've gotten out of the documents, some of which have been published in peer-reviewed journals, but a lot of the work has gone into the hands of some of our community activists who've been working really hard at trying to help our community understand how it is that the tobacco industry behind closed door has pretty much planned on how they were going to make tobacco the issue that it is today in our community.
So tonight I'm not going to really do a data dump on you with a bunch of numbers and graphs. We already know that. We're just going to talk about the real things that can perhaps make you think. When we talk about disparities in health, that's usually an indication of something else that's gone wrong.
I know that you attended the Black Physicians Forum last year, and you're back again this year. What was your top priority for attending this year?
I want to make sure that people know that the mayor of Sacramento, the mayor of this community, is committed to everybody being healthy. We want to be a healthy city. We know that the African community is disproportionately impacted in a negative way. When you look at an equity index, when you look at the big 5 areas of economics, which is jobs and political empowerment and education and social justice and health, we're at the bottom of all of them. And with these physicians in the room, we can change that with awareness, talking about healthy lifestyles. In Sacramento here, we're doing community gardens. We're trying to create an environment where young high school and college graduates come back to the high school and teach our young kids about healthy lifestyles and dieting and eating right. So we want to be a community that's leading the way, and the Black Physicians Forum is a great opportunity to talk about some of those things.
Thank you so much for attending. We appreciate it.